the gut microbiome. This was one of the first major papers to actually posit the idea of the gut-brain axis and the importance of the idea that what goes on in the gut affects the rest of the body. Now, the gut microbiome is broadly defined as all of the microorganisms within the entire GI tract of the body. And the best evidence is obviously for GI pathology. So IBD, colorectal cancer, C. diff, IBS, also been shown in metabolic syndromes like diabetes, obesity. Also things like autoimmune disease and allergies. There have been no large-scale studies on this, but there have been a few good RCTs that have shown that fecal microbiota transplant, or FMT, has actually improved symptoms in multiple sclerosis and Sjogren's syndrome. Also that probiotics have improved rheumatoid arthritis scores, as well as H1C in type 2 diabetes. And the newest kind of realm is on neuro and psych stuff. And instead of telling you all about it, I am just going to click on a review of this, and we'll just do a little scrolling. Scroll. This is a very long paper. Okay, here we are. Can you guys see the last column? Yeah, how do I get it? How do I get it over there? That's it, there are a bunch of them. So like this, for example, is for autism spectrum. You can just briefly read through key findings. Alleviation of symptoms, symptom improvement, well-tolerated, symptoms ameliorated, well-tolerated, positive effect, blah, blah, blah. Okay, we're gonna skip to another one. For MS. This is in Parkinson's disease. This is another one that I wanted to share. Especially with GI symptoms, motor symptoms in mice, reducing gut-mediated neuroinflammation, recovering motor function. All right, and then one last one. Have to throw it back to ex-Dr. Wakefield. The last one is in epilepsy. Autism spectrum disorder. The original, where'd it go? I must have missed it. Okay, I don't know where it is, but it's somewhere in there, is autism spectrum disorder. But broadly, you can see that there are a bunch of neuro and psych disorders that probiotics and FMT have been trialed in both mouse models and in humans that have shown a lot of positive effect in these small trials. All right, so how does this relate to us? What are we going to do about this? I want to talk about 3 of the ways in which we prescribe medications that actually impact the gut microbiome and why we should think about these things. So the number one thing that affects the gut microbiome that we tend to prescribe is PPIs. Second is antibiotics, and we don't prescribe these yet, but maybe in the future, probiotics. So I'm just going to talk about that briefly. Okay, so PPIs. Maybe we saw this sometime in med school. It blocks the whatever that little transporter is, prevents acid suppression. But acid is actually a defense system in the body. It prevents a lot of bacteria from growing. And so when you have knocked down that defense system, you essentially allow for a bunch of bacteria that weren't there previously to now explode. So somebody did all this research in like literally every cavity of the gut and was like, these are the microbiome changes. We're not going to go through that. Suffice to say that it basically causes bacterial overgrowth, can cause SIBOs, which causes symptoms like flatulence, bloating, diarrhea. Also causes an increased risk of C. diff. And acid is important for the metabolism of vitamins B12 and absorption of magnesium and calcium. So long-term PPI is associated with decreased amounts of these vitamins and minerals. What do we do about this in the ED? Well, what we should do is we should be prescribing PPIs appropriately and making sure our patients are actually taking them in the right way. So all of the major GI societies recommend starting with once daily dosing, 40 milligrams taken once a day in the morning, 30 minutes before breakfast, 30 minutes to an hour before breakfast, and for 4 to 8 weeks at a maximum. After 8 weeks, they should be reassessed. If their symptoms have improved, they should drop down to intermittent or as per needed dosing. If their symptoms have not improved, well, they should really go see a GI doctor to titrate it better, but it could be doubled or they might need an endoscopy to figure out what's going on up there. The next thing I want to talk about is antibiotics. This is kind of self-explanatory. Any antibiotic that kills bacteria is going to impact the gut bacteria. Broadly speaking, the broader the spectrum of antibiotics, the bigger the impact it's going to have on the gut microbiome. These are some of the antibiotics that have been mentioned in papers that cause the greatest effects to the microbiome. You will notice that most of these also have anaerobic effect, and that is known to be more powerful than antibiotics that don't have an anaerobic effects. Consequently, these are also the antibiotics that have the highest risk of causing C. diff. I don't like this chart. This is like one of the ugliest charts I came across, but then again, all of these like bacteria-related like graphs are so complicated that they're pretty much useless. But this was a trial with something like 1,500 people followed across 48 months. They were given antibiotics at the beginning of this time period. Unfortunately, the microbiota was not measured prior to the start of this, but they were given antibiotics and then their microbiomes were followed for 48 months. So the longest lasting antibiotics were the macrolides, lincosamides, which is clindamycin, and the the quinolones. Macrolides is thought to be because it's actually bacteriostatic, and this might actually turn out to be more harmful in the long run because it inhibits bacterial growth as opposed to just killing off a few species. What can we do about this? Well, we should ask ourselves, one, does the patient really need antibiotics? Is a diabetic foot wound really infected? We should have a conversation with patients that we're going to empirically treat. This means patients who have had an STD exposure and are not showing any symptoms. Maybe patients that have UTI symptoms, but their UA has not resulted, or their UA is not positive and their urine culture isn't back yet. We should have an honest conversation about them, about what are the actual risks of antibiotics, and make some shared decision making there with whether we're actually going to go through with this. We should prescribe antibiotics for the shortest duration necessary. At least my practice has been when I get a range from 5 to 7, I tend to go with the 5. We can discuss this afterward. And something I think we're actually quite good at is picking the narrowest spectrum antibiotic for a certain indication. And lastly, I want to talk about this new and exploring field. I'm going to preface this by saying that the AGA only recommends probiotics in adults and children who are taking antibiotics for the prevention of C. diff. And that is a conditional evidence statement with low evidence behind it. A lot of this has to do with the fact that probiotics are not managed by the FDA, which means that we kind of have no idea what's actually in them. So that can make making guidelines about this very difficult. These are the 3 species that have been tested the most. Lactobacillus Saccharomyces bifidobacterium, when we were looking at all of those studies that had to do with Alzheimer's, Parkinson's, epilepsy, these were the probiotics that were mentioned. This may be useful to your patients. This may be useful to you if you find yourself being convinced by this presentation. Generally, these studies recommend that probiotics should be used in more than 10 million colony forming units for about 8 weeks for the results to happen. And if you don't want to go into the pills, probiotics kind of health maha kind of business, then you can just eat fermented foods like kimchi, kombucha, that sort of thing has been shown to have almost the same effect. All right, so in summary, what are my takeaways? 1, pause before you're giving PPIs, antibiotics. Ask, do your patients really need them? What are their risk factors? Prescribe both PPIs and antibiotics for the shortest duration possible for the indication in front of you. And the gut is important. It affects nearly every other part of the body, and this is like a huge area of research that we're coming into, and we may see new medications and therapeutics coming up, like probiotics. Thank you.